I am Dr. Tanseer Asghar. I am Managing Director of GLR. I am laparoscopic general and bariatric surgeon working in Pakistan. Today I will be telling you how to assemble and how to troubleshoot the lap stack. So coming on to the laparoscopic tower, we have a monitor, we have light source, CCU where the camera head is attached, and the insufflator. So we broadly divide it into two things. One is the image system. The image system consists of a telescope, a camera head, a light cable which is connected in the light source, which is also a component of it. This is the CCU where the camera head is attached. The other component is the insufflator, which takes the carbon dioxide and it insufflates the abdomen of the patient during laparoscopy. So what we do is how to assemble this system. So this is a lap tower which you can see is this monitor is mounted on the lap tower, and what we will do, if you see over here, we connect a DVI cable from the DVI out port behind the image system, which is CCU, and we connect this with the monitor DVI in, right? What else we do? We connect this cable, which is the power cable, into the socket of the light source. Here we connect it into the power socket of the camera system, and other power cable is connected to the insufflator. This is a cylinder which is connected, a carbon dioxide cylinder, which is connected to the insufflator here. Now we will switch on these systems. We'll switch on the insufflator, we will switch on light source and the camera system, and everything will be displayed on the monitor. So if I tell you, this is a telescope which is a 10 degree telescope. This is 0 degree telescope, right? 10 mm. Okay. So there are different types of telescopes. This is a 10 mm telescope with a 30 degree view. Okay. So there are some telescopes which some companies make which are of 45 degrees and with 10 mm diameter, and there are some companies which make a telescope which rotates from 0 degree to 120 degrees so that the view is better during surgery. So we have also telescopes which is 5 mm in diameter, here you can see, right? And this is 0 degree. And then we have the 5 mm with 30 degree as well. This is a camera head, right? So we attach this camera head to the central unit, imaging unit, like this. So when you will see here, you will see that the camera head is being engaged. In front of the camera head, we attach this telescope. Bring gauze pieces. This telescope. This is a 10 degree telescope, and here you can see the image. What else we do to brighten the image? We attach this cable to the light source. This is the light source, and we attach this on the top of the, here you can see we have attached it on the top of the telescope. Okay, so what now we do is, so you can see on the camera head there are two knobs. One is for magnification. If you just put the camera on the screen. One is for magnification. Here you can magnify, you know, like this, right? This is whole screen, and the other one is for fine tuning. Here you can see the image is being made fine. Okay. So the first thing you will do is you will do a white balance. So different systems have different ways of doing the white balance. So in this system, you press this button, if you can see, once. When you press the button once, if you can show on the screen, here you can see there is a user menu, right? So with the other button, you go down, and on the white balance button, you press it. So if the white balance is okay. So if the white balance is okay, here you can see you can just clear the image by rotating the knob, and the image is perfect now. Okay. So again press that button. What else we have in it? We have enhancement, brightness if you want to change the brightness. Okay. This is light source. This is insufflator control. Okay. Program head buttons. So the most important thing in this user manual, which we have to use every day, is white balance. And now you can exit from here. So you can also do recording of the system. Most of the systems these days has got recording. This system has got a USB recording system. So you can attach the USB over here, right? And once you will press this left button, okay, it will start recording. Okay. I'll now put this over here. We will come back to the camera control unit with some other options in it. Once we go to the insufflator system. So this insufflator is connected to the carbon dioxide cylinder. Okay. So we attach this pipe with the carbon dioxide insufflator, and we take a port which is introduced into the abdomen, and we rotate it anti-clockwise and then clockwise, and then open the port. Now what you will do, this is the power button of the insufflator, as you can see, right? This is start and stop button of the insufflator, right? So this is the area where you can see the pressures of the patient during surgery, which is usually set at 14, but you can increase the pressure to 15, 16, or you can decrease the pressure to like 10, 12, depending upon the medical condition of the patient and the procedure you are performing. Okay, so this is a button which shows that what is the amount of carbon dioxide being sent into the abdomen. First, we usually start with low pressure, then we convert it into medium, then high. So this is the bar which shows how much carbon dioxide is going in and what is it is maintaining, which is the flow rate, and what amount of volume has gone, this shows. Okay, we will start it from here. Okay. Now you can see that the pressure is going up. So the pressure is going up because of the fact that I have put my hand over it. Okay, so you have to maintain this pressure around 14. When it is going into the abdomen, it will make the pressure 14. Right. Initially it is low, then medium, then high. It is like this, and this shows the volume. If the tube is obstructed some way, one of the problems we encounter is that tube gets obstructed while surgery, like this. Okay, so the insufflator will show an alarm. The tube is obstructed. Okay, go back and see what is the problem. That the tube is obstructed. You just address this, then again the pressure will be back. Sometimes you are working and tube will get dislodged, okay, and the pressure suddenly falls. You just reattach it and the problem is usually solved. Sometimes this is a cylinder, sometimes it's not open and the bar over here which is showing green, it becomes red. You can ask the assistant to open the cylinder, it will start working. Sometimes during working the light goes and comes and it suddenly stops, so you have to restart it. So these are some of the problems which are associated with insufflation. Coming back to our imaging system, sometimes when we are using our laparoscope on the TV, on the monitor, you will be seeing that there is some purple colored hue over here. It means that there is some problem with this cable. So it has got small filaments. Sometimes they are not taken care of properly, they break down. So it is important to get the service of your system always. So this is a knob which will increase the intensity of light, right, like this, okay, and it will reduce it like this. So usually it is set at 50%, but in some cavities you have to increase it, in some cavities you have to decrease this light, okay. Sometimes when you are working, this light gives problem that it is very low. This is basically LED system, so you have xenon systems as well. So LED system has longer lives, about 50,000 hours or so they work. But when the life is over or there is some problem in the system, the light will not be proper there, and you have to address that. You have to get your things fixed. So once you are a surgeon, it doesn't mean that you should not be aware of the problems you face during surgery. The best thing is to place this insufflator on the topmost portion. Then comes the light source. Then comes the this camera unit. Because of the fact that when you are standing across the table and you are doing the laparoscopy, the one thing which every single surgeon asks for, what is the pressure in the abdomen, and if the pressure is too low and you have to climb up and see, it will be difficult over here. So it's better to put it over the top and rest down, okay. So this is a cautery lead, right? It is attached to the cautery system from here, and the other portion is attached either to the L hook or it is attached to the Maryland. This is a brief introduction about how to assemble a laparoscopic tower and what are the daily problems which we find while we are performing surgery. If you have any question, you can ask at the end of this. Thank you very much.